for joining. Thank you so much for joining us. My name is Leslie Morant. I am co-chair of the Physical and Mental Health Committee of Delta Sigma Theta Sorority Incorporated. We thank you this evening for joining us as we rock the ribbon together in celebration of World AIDS Day. So we thank you for joining us this evening as we discuss how COVID-19 has affected the mental health of the HIV/AIDS community. What we're going to do this evening is have an interactive session with experts in the HIV/AIDS and mental health fields. We'll provide information for where you can obtain HIV/AIDS, COVID-19, and mental health services. Make sure that you stay on at the end of the meeting because we have surprises for you. We've got a couple of raffles to give away at the end of the evening, so don't sign out early. Before we get started and I introduce the co-chairs of the Physical and Mental Health Committee and International and Awareness and Involvement Committees, we want to go through a couple of housekeeping events. Due to the number of participants, we are going to ask that everyone who is not speaking, everyone please turn your video off now. So you look to the left of your computer, the bottom right. I mean, we're all familiar with Zoom by this point, but we're going to ask you to stop your video and we're going to ask everyone to mute themselves. If you have questions throughout the program, sorors will be monitoring the chat. So feel free to type your questions in the chat box and those questions will be addressed. But we are going to ask you for the length of the evening to keep your videos stopped and to keep yourselves on mute. Thank you. Now we'll get started. And the first thing I'm going to do is introduce sorors Nikita Bobo Peden and Concetta Lilly, who are the chairs of the co-chairs of the Physical and Mental Health Committee and International Awareness and Involvement Committees, respectively. Sorors Nikita and Concetta.
Greetings, sorors and guests. Welcome from the Philadelphia Alumnae chapter of Delta Sigma Theta Sorority Incorporated. My name is Nikita Bobo Peden. I am one of the co-chairs of Physical and Mental Health. Physical and Mental Health, in partnership with our sister committee, International Awareness and Involvement, present in recognition of World AIDS Day, Rock the Ribbon. Thank you for joining us.
Good evening, everyone. My name is Concetta Lilly, and I am one of the co-chairs of the International Awareness and Involvement Committee of the Philadelphia Alumnae chapter of Delta Sigma Theta Sorority Incorporated. I bring you greetings on behalf of the International Awareness and Involvement Committee. We sincerely hope that you enjoy the program we have prepared for you and hope that you learn something new this evening. So sit back, relax, and enjoy the program. And finally, for those of you who feel led, today is Giving Tuesday. So be a blessing to someone in need. Soror Leslie Morant.
Thank you, Soror Concetta. I now introduce to you our chapter president, Dr. Penny Sparks Nixon, who will bring you greetings from the Philadelphia Alumnae chapter.
Good evening, and welcome to the Philadelphia Alumnae Chapter's panel discussion on HIV and AIDS, COVID-19, and mental health. I am Dr. Penny Sparks Nixon, the proud president of the Philadelphia Alumnae Chapter of Delta Sigma Theta Sorority Incorporated. And I am thrilled that you joined us this evening for this very important conversation. Today is World AIDS Day, an international day of unity against HIV. It's an opportunity for people worldwide to unite in the fight against HIV, to show support for people living with HIV, and to commemorate those who have died from an AIDS-related illness. Today's conversation will hopefully help us put heat and light on the need to continue to fight the stigma of HIV and AIDS and how it impacts our communities. As members of Delta Sigma Theta Sorority Incorporated, we are committed to serving our communities by offering programs that are educational and impactful. Thank you again for joining us this evening.
Thank you, Soror President. We will now introduce our panel moderator for the evening, who is Soror Dr. Karima Bell-Lynham. Dr. Karima Bell-Lynam is an Associate Director, Medical Affairs in the Pulmonary Arterial Hypertension Division of Janssen Scientific Affairs, a pharmaceutical company of Johnson & Johnson. She began at Janssen in November 2013 in the Neuroscience Division and has been responsible for leading and providing medical clinical expertise to scientific projects, including clinical trials, scientific communications, publications, and other research-related activities. She began her career working in the Philadelphia VA Medical Center as a clinical, I'm sorry, Sora's my eyes. I'm sorry. I just need to enlarge that. I'm sorry. As a clinical pharmacy specialist in psychology. Can I ask everyone to just make sure that your mics are muted, please? Thank you. She received her doctorate of pharmacy degree from Florida A&M University in 2006 and completed a pharmacy practice residency in 2007. Dr. Lynam earned her board certification in psychiatric pharmacy in 2013 and a Master of Business Administration degree with a concentration in healthcare management from Drexel University's LeBeau College of Business in 2018. Dr. Lynam is the proud mother of a 10-year-old daughter and spends her free time acting as a chauffeur to all of her daughter's activities, spinning music, producing for 2 podcast shows, writing, reading, and exercising. Dr. Lynam serves as a vice president of the Philadelphia chapter of the Florida A&M University National Alumni Association and is an active member of the International Awareness and Involvement Committee of the Philadelphia chapter of Delta Sigma Theta Incorporated. We thank Sora Lynam for her participation, moderation, and for organizing this event. Dr. Lynam?
Thank you so much, Laura Leslie. I'm so excited to be here and I get the opportunity to talk to you all tonight and provide the purpose. You've heard a little bit of an overview about why we are here tonight, but I want to give you a little bit more information. So we all know that today is World AIDS Day, which was first observed in 1988. On this day, organizations all over the world, including my beloved Delta Sigma Theta Sorority Incorporated, bring attention to the HIV epidemic, endeavor to increase HIV awareness and knowledge, speak out against HIV stigma, and call for an increased response to move toward ending the HIV epidemic. We aim this evening to highlight the 2020 theme, Ending the HIV/AIDS Epidemic, Resilience and Impact, with also taking into our current state that no one knew would happen this year, which is COVID-19. And we also are going to think about the light that has been shined on social injustice and systemic racism, which has carried over into our healthcare system for over 400 years. So what we'll do is actually get started with a poll just to test knowledge. It's just a little bit of fun, so no worries. Just shortly, you'll actually have some questions that come up on the screen. If you could go ahead and answer those questions for me, I'd appreciate it. All right, and I can actually see percentages of how they're coming in. So again, take your best guess. We have 101 people on right now. All right, we're starting to get some votes in. Thank you, they're coming in. And remember, there's no real wrong answer. We will discuss these questions in detail. Thank you. We're at 22%. That is my line number, so I love the number 22. All right, we're going to give it a couple more seconds for this to keep going. They're coming in. You guys are answering. Thanks. I wish I had like Jeopardy music or something playing, but you get the idea. All right. Just 30 more seconds. We're up to 64% response, so doing pretty good. All right, looks like votes are slowing down. So if, let me give it 10 more seconds. They're starting to come in. All right, thank you. So I think if we can share those results. Awesome. So as you can see, for the first question, there is an approved vaccine, true or false? 83% of you all said false. Next question, people with HIV are more likely to contact SARS-CoV-2. True or false? 60% of you all said true. The loss of community members compounded by the relative isolation based on stay-at-home orders and social distancing measures act as a stressor by limiting access to support system. True or false? 96% of you all said true. Our next question, what disparities place African Americans at greater risk for trauma, grief, and other mental health issues as it relates for COVID-19? And this was a multiple choice question, and I'll say 87% of you all said all of the above, which included higher rates of chronic diseases, twice as likely not to have health insurance compared to whites, more likely to live in cities and in close quarters where COVID-19 spreads more easily, and then lastly, less likely to have jobs that allow telework compared to white and Asian Americans. And then the last question, people living with HIV are twice as likely to have depression compared to those who are not infected with HIV. True or false? And 86% of you all said true. So thank you again for participating in this poll. And again, during this presentation, we will talk a little bit more about this. So now here is time for, I would say, the fun portion of this presentation. I have the pleasure of introducing our guest panelists for tonight. And so if they can also come onto the screen with me as I speak very highly about each and every one of you all. And as I begin, I'll kick it off with Kate King. Kate King has been with Action Wellness for 14 years, beginning as a volunteer and working in varied roles such as housing specialist, medical case manager, and program specialist over the years. An emphasis in providing support and advocacy to those living with HIV/AIDS within the deaf and hard of hearing community has been her primary focus over the last decade. Additional tasks include coordinating HIV/AIDS support groups within the community, advocating for ongoing state, federal funding vital to agency programs, and continued medical case management to underrepresented populations within the Philadelphia region. Thanks for being here, Kate.
Thanks so much for having me. I'm really appreciative to be able to join the panel this evening. It's a privilege and an honor to be here, specifically on World AIDS Day.
Awesome, thank you. And now I'll introduce Dr. Keisha Clark. Dr. Keisha Clark is a licensed clinical psychologist. She received her Master of Science and doctoral degrees from Drexel University, where she was trained as a clinical neuropsychologist. She completed her clinical residency in the U.S. Air Force at Malcolm Grow Medical Center on Andrews Air Force Base, home to the U.S. President's Air Force One. Following residency, Dr. Clark served as an officer and military psychologist in the Air Force for nearly 7 years, during which time she provided direct clinical services, training, education, and outreach to military members, commanders, and military families. Her previous appointments included Chief of Psychological Services, Flight Commander of the Mental Health Clinic, and Director of Psychological Health. Following her honorable discharge from military service, she relocated to Delaware, Philadelphia area. Since that time, she has continued her work with veterans with an appointment at the Philadelphia VA Medical Center and Clinical Associate of Psychiatry in Perelman School of Medicine at the University of Pennsylvania, and has operated her own private practice in Wilmington, Delaware. She also instructs graduate level mental health courses as part-time faculty at the University of Pennsylvania. Dr. Clark is an active in her community as well. She has served in leadership positions while an active member of Junior League of Women Wilmington and the Wilmington, Delaware chapter of the Links Incorporated. Each of these organizations are comprised of professional women committed to volunteering in her community. Thank you, Dr. Clark, for being here. Oh, you're on mute.
It's my pleasure to join you in the panel today to have this conversation on World AIDS Day. Thank you so much for the invitation.
Thank you. And that might be our favorite line tonight is you're on mute, but anyway. All right. Last but certainly not least, I will be introducing our final panelist, Dr. Kimberly Brown. And I will have to say that, you know, Dr. Brown has actually been with us in a program similar, and you may all remember we've been hosting a program called Know Your Status for the past few years, started in 2016. And she's always worked with us around, you know, educating our community for HIV/AIDS awareness. And so we're happy to have her as our partner in crime in order to educate our community. So welcome, Dr. Kimberly. So Dr. Kimberly joined Janssen, the pharmaceutical companies of Johnson & Johnson, in 2007 as a medical science liaison from the Rainbow Center for Women, Children and Families in Jacksonville, Florida, where she served as HIV clinical specialist and clinical assistant professor at the University of Florida School of Pharmacy. Kimberly holds a Doctor of Pharmacy from University of North Carolina, Chapel Hill, and completed a pharmacy practice and infectious diseases specialty residency. Since joining Janssen, she has also served as Associate Director, Training with responsibilities for Virology Medical Science Liaison Team. She also served as Associate Medical Director of U.S. Medical Affairs Infectious Diseases, where she was responsible for working at part of both the HCV, which is hepatitis C virus, and HIV clinical teams to lead efforts on research trials and launch team activities. She was also responsible for acting as company's pharmacovigilance officer. From 2015 till January 2018, she serves as the U.S. Medical Director for the HIV franchise. Then she served as Scientific Director for Janssen Research and Development, leading 2 large phase 3 trials and several phase 1 studies. Now she serves as National Field Director and is responsible for medical strategy for field-based medical teams and development for the broader infectious disease organization, including vaccines. In her free time, Kimberly serves as recording secretary and co-chair of Technology Committee for Delta Sigma Theta Sorority Incorporated, as VP of Marketing for the Junior League of Philadelphia, as a board member of Vitri Community Partnership, the Brodsky Center Advisory Board, UNC Pharmacy Alumni Association, and UNC's Alumni Committee on Racial and Ethnic Diversity. Thank you so much, Dr. Brown, for being with us here tonight.
Thank you all for having me.
Awesome. So I'm excited for us to kick this off. And I think one of the things I'm going to say now is that my main goal tonight is not to get tongue-tied because we have all K names. And so if we can get through that, I think we are successful. Okay. Okay. I'll start that. So let's have actually Kate Keene kick it off. What is Action Wellness and what services do they provide? Also, how have you and the staff at Action Wellness been handling patients during this COVID pandemic?
Sure. So Action Wellness began as Action AIDS in 1986, specifically when a group of volunteers got together to want to bring support and advocacy for their loved ones, their friends who were living with HIV and AIDS during a time where it's very much stigmatized. They wanted to show everyone that no one should face this alone. And out of that group of volunteers, Action AIDS was born. And over the years, we evolved and are able to provide medical case management services through the community, specifically those living with HIV and AIDS. And also we have 5 offices, 2 in West Philly, 1 in Center City, 1 in North Philly, and we also provide services in Chester. So the crux of our program is our medical case management services. And what we do is we go out into the community and accompany clients to medical appointments, making sure they're adhering to their medications, making sure that they have the correct insurance coverage and are aware of programs that can help provide assistance when they need mental health resources, drug and alcohol, referrals, and things of that nature. And so 2 of the programs I just wanted to touch briefly on that I feel are unique to our agency are our perinatal case management position. So we have case managers who deal primarily with moms who are living with HIV and AIDS, and they provide services when mom is pregnant all the way up until the first year after the baby's born. And we wanted to give education specifically surrounding breastfeeding, because that's a way of transmission of HIV and AIDS, and also be able to provide resources specifically for postpartum. The other program I just want to highlight is our prison linkage program, where we're able to connect with individuals living with HIV and AIDS or recently diagnosed with who are incarcerated at that time. And what we want to do is provide a link and a liaison to be able to have those individuals have supports when they are discharged to be able to be linked to medical care, as well as supports with finding employment and also returning into the community. And so as our agency has evolved over the years, we understand that HIV and AIDS has since evolved into a managed chronic illness. And so over the past few years, ActionAIDS has expanded its services to specifically with people who are experiencing comorbidities in addition to HIV and AIDS, such as high blood pressure, diabetes, and asthma. So ActionAIDS in turn opened our umbrella even more, and we rebranded as Action Wellness. So we were able to provide additional services, not just to those people living with HIV and AIDS, but to also those individuals who are experiencing hardship with other chronic illnesses. And so with this community, we were actually hit hard by COVID-19. At the beginning of the year, our staff went virtual. And so we had never worked from home before, and our primary focus and care was making sure our clients were still connected to their medical services. There was a huge shift to telehealth, and we had to work hard to make sure individuals had access to Wi-Fi to make sure that they were able to manage Zoom, that if they had medications that they were going to the pharmacy, that they're able to get them delivered. We're able to make sure that clients have access to food, that they're able to have the supports that they need in place, and also be aware of the CDC recommendations as to wear masks, keep your social distance, and also to wash your hands. And so we began wellness checks with our agency. So we checked in as often as possible to make sure people are also being supported mentally and emotionally. And I feel like that is a huge part of COVID-19 and HIV and AIDS, as people who have already been living through an epidemic have to come in terms with going through a pandemic. And I feel like the social isolation and mental health is a part where they really struggle with. So thanks again for allowing me to explain everything.
Yeah, thank you. And I think those points around just some of the isolation and those kind of things, I think is a perfect segue to kick that over to Keisha. So Keisha, my first question for you is, since patients are being asked to isolate and limit that human contact, what are some of the mental health effects of this isolation, and what have you seen change since the start of this pandemic and even seeking mental health services? Because as we both know, there is a stigma, of course, we said with HIV, but also a stigma with mental health, and especially with seeking care in the Black community.
Yeah. So just to start off, anecdotally, the mandate to self-shelter in and social distance from family and friends, which can isolate people, has impacted people differently based on a number of factors. And I will often allude to just the normal spectrum of mental health, just to acknowledge that it does exist, and that the vast majority of people are able to cope and are resilient. And of course, people living with HIV are no different. And so, for instance, some welcome the chance to stay home while others felt that, cut off their opportunity to connect to others completely. As you can imagine, the many factors that may be protective or not can include having a family to shelter in with versus living alone, having friends you can have constant contact with through various forms of communication if that's available to you, versus having connections just at work or in your community or not many at all. So these differences have resulted in different responses to the mandates of social distance that ultimately determine how isolated or lonely someone can feel. However, my work is to assist when people are struggling to cope, right?
Yeah.
So overall, I have noticed through my own practice, through requests for referrals, but also through the data that is being collected at both community and national levels, that there is an uptick in anxious and depressive symptoms, not necessarily disorders, but essentially symptoms among people who've been dealing with mental health concerns, as well as a new emergence of symptoms among people who don't have a history of mental illness at all. And specifically, we're seeing more panic attacks, we're seeing more generalized anxiety, worry, fear, restlessness, hopelessness, depression, irritability, but also substance abuse, which is a significant concern because that leads to overdosing, obviously.
Yeah.
And at times fatal. So this isn't new for the community of people living with HIV, as depression and anxiety, among many other mental health concerns, are either pre-existing or co-occurring with HIV at high rates. There's also documented concerns that the Black community has been twice as likely to experience these mental health consequences as a result of COVID, whether they've been infected with COVID or not. And this is obviously because of social determinants associated with racial inequity. The stressors many in our community are facing right now is just at an all-time high. And we are all aware that chronic stress really does significantly impact the immune system in a negative direction and the body in general. We can't forget grief reactions is also expected as the death rate is higher among African Americans who contract COVID, and trauma associated with civil and political climate right now and just ongoing unrest also suggests our community has experienced a number of stressors that amplify their risk of developing or exacerbating mental health symptoms. So in the end, healthy social contact is both preventative and therapeutic for most mental illness, and isolation is unfortunately a key ingredient in mental health decline. And it limits people's access to their support systems, or it gets in their way of them developing essential support when they don't have it. And so this is doubly important in the HIV community, as we know that poor mental health and psychiatric illness interferes with every aspect of the intervention process of managing HIV. It gets in the way of awareness being raised, prevent HIV for those at risk because they're just not emotionally available. It reduces the likelihood of people using pre-exposure prophylaxis. It reduces the chances of someone being screened to be diagnosed. And it obviously impedes the consistent use of antivirals to reduce viral load. And that's just a few things. We're not talking about all the range of things that goes into a person's wellness and their ability to live a life that allows them to thrive. So it makes complete sense that we pay attention to the service delivery models to reach people during this pandemic, to find ways to overcome the barriers associated with mandated isolation and social distancing that's needed to keep people safe from COVID. But also we need to encourage connection and engagement by any means available to the people we know are at increased risk, because isolation is necessary to manage or it can lead to more significant issues.
And I have to say, Keisha, I've seen some creative things happening during this time period. And I think that other piece that you mentioned about, hopeful, I think the hopeful thing that you did say is that uptick of seeking care. I think that's something that we have to talk about and have to highlight. And, you and I are in this whole mental health, space. And that's something that's super important because that wasn't always the case. And we know that from history. So I think that's
if I can just add to that uptick, it's really been a point of hope to see that people are asking for referrals sometimes for the first time. And if you notice, you're starting to see more of these sort of resources that are devoted to, Black men who are seeking therapy, Black women who are looking for therapeutic spaces. And of course, we're seeing school-based and school-wide initiatives that target our children. And because of telemedicine is making it more of an opportunity and more of an option for many more communities than it did before. So it is quite hopeful to see that. It's kind of breaking down the stigma, if you will.
Yeah. And I was just thinking, I said, no, we're going to get into a telemedicine kind of talk around this stuff. But, definitely, I was thinking that it has to be contributing to it. The fact that, you're not having to worry about catching a bus to go and see the therapist. You can actually just get on your computer screen. But, Kate mentioned earlier about just making sure people have access to Wi-Fi. That's something that we have to kind of consider. So thank you. And I'm ready to get into that conversation as well. Lastly, I'm going to bring Kim into the conversation, Dr. Brown. Can you, and we always love having you to kind of do an educational overview. So I'm going to stop sharing my screen this time and see if you can talk to us a little bit about HIV/AIDS, what's new, and how we are managing patients again during this COVID-19 environment.
Absolutely. So thank you all again for having me today. So, one of the topics that you all mentioned was the need for connection and feeling isolated. So I do want to remind folks that while that is the case, that we need to also remember to protect ourselves if we decide that we need human connection. And that while COVID has been very much on the forefront of everyone's minds over the last few months, this does not mean that HIV has actually gone away. So just to ground everybody, just quickly in just a few stats, that HIV is really affecting communities of color and Black people more than any other. So just as a quick point, just over 40% of people in the US that actually have HIV are African American. So please, please, please just be mindful and remember to protect yourself from all of the ways that we were talking about before, to make sure that you're not walking away with 2 potential viruses at this point, not just one, because COVID is on the top of everybody's mind. But to your other comment about, what's new. So we've made a lot of progress over the last few years with respect to what's actually new and what's going on with HIV. So again, as I mentioned before, we're seeing that there are more or less 2 pandemics or epidemics that are actually going on where HIV infected individuals are more so affected in the African American community than we actually see in any other. Part of that is what we call a health disparity. So a health disparity is really nothing more than a higher burden of illness that we see in one particular group than we see relative to any other group. So you all probably remember Dr. Fauci's talk, or it was a White House briefing. Gosh, my slides are going all kinds of crazy. It was a White House briefing a few months ago, back in April, where he was talking about health disparities. So I just wanted to play a quick clip of what that looks like, but for the sake of time, because I think we are a little bit over, I'll just read it to you for efficiency. So he said, we have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately affecting minority populations, and particularly African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they're just those very comorbidities that are unfortunately disproportionately prevalent within the African American population. So we're very concerned about this, and overall he was saying that it's very sad. We really can't do anything about it right now except to try to give the best possible care that we can. So to bring it back to HIV, because there are some concerns about people living with HIV who may be more at risk because of an immunocompromised immune system, we did want to make a few points to let people know that, yes, there could be more of a risk for anyone who has a depressed immune system. So specifically people that have a low CD4 cell count or people that have HIV that may not be on treatment. So you may say, well, yeah, that's all fine and good, but we also have to remember that there's a significant portion of the population that don't even know that they're HIV infected. So when we talk about knowing your status, and I realize that that's not the theme for this year, still knowing your status is so, so, so important. So I'll kick it back to you before going on to a few other topics.
Oh no, this is a great segue. Thank you, Kim, for bringing that in. I think one of my first questions I want to start off with, and we kind of started talking about this, is some of the barriers, and I'd love to hear from everyone on the panel. What are some of the barriers that we've found during this time period with patients living with HIV and AIDS and receiving care? And I know we kind of started talking about the telemedicine, but what are your thoughts around that? Because I have some thoughts of my own. Anyone can feel free to start off. Oh, Keisha, you're on mute. Didn't I tell you guys that was gonna be my favorite line? I think I'm holding to that.
I want to start off from a mental health perspective because I do think bringing in a physical perspective does make it a little bit more complicated because there are greater needs in that regard for physical examining. But one of the greatest developments from my perspective of this whole pandemic is the widespread use of telemedicine, something that we've been slowly working towards for decades. Literally, regulatory issues, technology challenges, privacy concerns, lack of awareness in general, that it was an option, just sort of slow progress for years. And here it is with the pandemic, overnight, all of a sudden with more accessible technology, Wi-Fi if you have it, and just sort of the will now to see people in a distance format or in a remote way, kind of change things for us overnight. And so we were able now, or we are able to access people in
Oh, I'm sorry, Keisha. I think we're having problems with your internet.
Typically, it was much more difficult. The time that it takes to get from, your job to a office. Can you hear me now?
Yeah, I hear you now.
Okay. Oh, wow.
But yeah, you were kind of talking about that timing
time
of
to work in an extra. Yeah, the time that it takes to work in sort of an extra responsibility that we can be impeded if someone has to travel to you. And so all of a sudden you can now just sort of things. So for mental health, where physical exams aren't necessarily needed and visits can be frequent, they can be weekly at times, it can burden anyone's schedule. And, telemedicine has been an amazing way to reach people and give them access to care. It also can be a way of giving education, support, treatment, preventative services, all that can be managed virtually for individuals and groups. However, the problem with it is for our African-American communities, urban communities, low-income communities, there may be significant barriers to accessing this care. There could be lack of awareness that the option even exists, right? It could be that the infrastructure wasn't in place before all of this happened. And so now, how do you now get all this information out and communicate it to people? The lack of insurance, which can be in general or due to the downward spiral related to the pandemic of someone losing their job and then also losing their health insurance, unfortunately. The lack of working or upgraded tech devices that can support certain virtual care options. The lack of access to communication infrastructure, either Wi-Fi or reliable phone. If you have unstable housing, likely phone access is not always available to you as well. The need to engage care in person, particularly for certain people who are at high risk, or if you're, getting treatment for substance abuse, where physical contact, among other tools, can be used for accountability and support. You may need that. And so virtual care is not gonna, give you that option. It's not gonna service that. And also just in general, you're asking people to triage themselves. So you're asking them to know when they should do telehealth versus when they should be seen in person. And that can be very much a burden on folks trying to figure out their care. And so what we know is that, people living with HIV show great treatment success when they have multi-level, multimodality care. And sheltering in, as we already talked about before, can cut people off from their support systems. And so that is an aspect of the care that requires someone to really think through, how do we creatively include people's communities and their support systems and their family support? And that quick changeover is not always amenable to working through those kinds of options. And it doesn't always happen in a way that is communicated to people where they unfortunately may be lost to follow-up, because that's the other reality, that if you were seeing someone, they may not necessarily be back on your caseload, or they may not be able to get back into services if they're not aware of how to do that. So yeah. Yes, it's an amazing accessible point for clinicians and for them to reach their clients in many different ways and many different spaces. However, there are a lot of barriers associated with it as well.
And I think about, and Kate and Kim definitely jump in. I think about with regards to the comorbidities that the patient group may be facing, like you talked about, some of those physical touch things that may need to happen. That's been a lack of, and it's been interesting in just my field of, some of the complaints. So you hear a lot of people saying it's great, especially from a mental health standpoint, able to access therapists easier, but then some people still want that contact with their primary care provider. So I want to see from Kate, how has that, from an action wellness, and also Kimberly, from like a research standpoint, how have you guys heard that kind of pushback of, wanting that direct care and that direct contact? But I think more people are getting used to it, but I still think it's some that are maybe not.
I definitely agree. I feel that the population and the clients that I have served have said that they're used to a routine. They're used to seeing their providers on a quarterly basis. So they're used to being able to go in and get their vitals, and that feels comfort because then they're able to get the results. And then moving forward, they can either make adjustments or being able to know where they stand. And I feel that after a while, when the pandemic started, people were understanding about, yes, we have to stay home and we shouldn't go anywhere or go to see our providers. But over time, I feel that as the months have gone by, a lot of my clients have expressed, yes, I want that face-to-face and I want to go in because I want that. I want to step on the scale, or I want to know my blood pressure and things that they can't do at home and take care of themselves in that respect. And so I find that clients have been able to reach out to their providers. Some of the providers say, do you want to come in or do you want to do virtual? Which do you prefer? And then moving forward, I feel most providers are saying half and half. So if you're seen on a quarterly basis, you'll be able to come in twice a year and then the rest will be virtual. And on the flip side, I have some clients who are very much paralyzed by fear with everything going on, that they are missing checkups. And so that provides I've had clients not go in for routine visits or maybe mammograms and things like that. So that's a concern that those things are slipping and that things aren't being diagnosed in a way that that could be harmful to the client. So as long as they're able to express their needs to their provider and for the case managers to provide that support, I feel whatever is more convenient for the client at that point.
Thank you.
Yeah, and I would agree with that. Just a few points to make that I think not only impact people that have HIV, but also folks that don't have HIV when we're thinking about engaging in healthcare is just try to do your best to reduce your exposure. You know, we've all heard about masks, we've heard about social distancing, we've heard about hand washing, and we can get into a little bit more about that. But if you choose to go in, make sure that you're doing those things. I think one of the other important points is, and I'm guilty of not maintaining at least a 30-day supply of medications. I think, you know, the most recent lockdown probably came as a surprise to a lot of people. So making sure that you have an adequate supply of your medications, and especially for folks that are HIV infected, resistance can happen so quickly. So you need to make sure that you're taking your meds every day the way that you're supposed to and at the right time. But again, this follows suit for anyone that has any sort of disease, if you will, hypertension, diabetes, cholesterol, same thing. And I think it's also important, you know, as Kate was talking about, to really consult with your physician to really understand, do you really need to come in? You know, you may want to, but do you really, really need to? Can it be handled virtually? Do you really need to get your labs done at that particular point in time? Or can you wait maybe another 1 or 2 months to actually get it done? So I think, you know, just looking at the collective risk of you going in to check the box, so to speak, versus you really needing to go in to get care for an acute problem should really be considered and should be a conversation between that person and their healthcare provider.
I think that's going to be interesting to see the data on that, right? Because if we've kind of come up with these structures of these schedules, you need to get your, you know, glucose checked every 3 months, HbA1c every 3 months. You need to have a lipid panel, like all of these things that we've outlined, especially since the medication, some of the medications for treatment of HIV/AIDS do increase those risks for diabetes and cholesterol issues. Like, what does that look like after this pandemic is over? By the way, does anybody know when the pandemic is going to be over?
Right.
That's $1 million question that I want to ask.
I can guess, but.
So let me remind the attendees, this is very interactive, even though you're not on camera and we can't see you, you can see us. Please enter any questions that you have in a chat box. I can just keep going because this is an area that I'm interested in, but please do use your chat box to ask us any question. We will go back to you. I also want to give a small disclaimer that I forgot to give before we started this, but 2 of our 4 panelists, and you probably know from our bios, work for a pharmaceutical company that is developing a vaccine for COVID-19. Therefore, in order to ensure we do not have a conflict of interest, we will not be able to talk directly about the COVID-19 vaccines that are currently in the makes. So I just want to, you know, put that disclaimer out that we will not be able to address that, only because we are affiliated with some companies. Kimberly, I don't know if you want to say anything else. I think I covered it.
Yeah, we can answer some general questions around it, but no specifics around any particular company's vaccine.
Awesome. So let me ask you, Kim, just to kind of get back, and this is also for Kate, are there any thoughts about STD rates increasing or decreasing during this time? Because in my head, I'm like, well, if there's stay-at-home orders and no one's really going out, I would expect like overall STD rates to be lower.
So we've actually seen that the percentage of social media apps and specifically dating apps such as like Grindr and things of that nature have gone up dramatically. They've also done some modeling as well, looking at previous events where we haven't been on lockdown like this per se, but they've seen that the rates of STDs have increased overall. We already know that we have an issue with gonorrhea and chlamydia going on in Philadelphia. That's just up front. So now with people being in quarantine or socially distanced, not going out, not having to go to work, there's a lot more opportunity for folks to engage in risky behaviors. And so some of these models have actually projected that we would see 3 times the amount of STDs than we were previously seeing before, which is huge. And I think the important thing to note is that, you know, I always used to tell my patients back at Rainbow, you know, STDs are like girls going to the mall. They never go by themselves. They always go in either pairs or they go in groups of 3. So we really, really need to know what our statuses are and make sure that we're protecting ourselves in any type of engagement, whether that's a COVID related engagement or a sexually related engagement.
Yeah. And Kate, anything from you?
Oh, I was just going to piggyback and say that I don't believe that more people at this time are getting tested for HIV. So I feel like that is a barrier in terms of the virus being spread about, because a lot of people, like Kim has said, aren't aware of their status. So I feel like that, again, is a concern. And we also in our agency have been concerned about the rise in STDs at this time.
Thank you. And I know we've kind of talked about what's new in HIV. Is there a vaccine currently for HIV treatment, like for HIV/AIDS?
Yep, so we can talk about some of the things that are new within HIV. So I'd say first, there are a few new formulations that are almost here. So you all have probably heard me talk before about, you know, a shot that was coming. Well, we're literally on the brink of actually having a shot to treat HIV infection. So this particular shot, potentially, if approved, could be given once a month or in some patients once every 2 months, which basically means they would not have to take pills every day like they normally have to. And that may seem like, oh, well, it's a shot, I don't know. But for an HIV patient, that's extremely significant. Many of my patients used to tell me that they would think about their diagnosis every time they had to put that pill in their mouth, every time they had to think about hiding their pills from a family member. So giving people the freedom, one, to be able to take an injection and only have to worry about it either once a month or once every 2 months is extremely significant. And it also from the standpoint of adherence, because we know that, you know, like I said, I'm the worst pill taker ever. So for people like me who miss pills every now and then, this is also a great and huge breakthrough. The other big thing is implants. So we're also studying a lot of implants, and this is across the board, not J&J, but implants right now as well, where they would put an entire patient's regimen within an implant, inject it into their arm, and it would stay in for somewhere around 3 to 5 years. Again, all the same benefits that I spoke about before with the injectable, but this is something that we will probably see at the next few years as well. And then from a prevention standpoint, which is what you were getting at, you all have heard me talk about the 1 pill once a day preventative method that's been out on the market for a while. It's not heavily used in communities of color, but it has been shown to have about 95% efficacy with respect to protection of HIV when taken the right way. Now, with respect to your direct question about an HIV vaccine, there have been a number of HIV vaccines that have been studied along the way. But there is one that is extremely close, and there should be data coming out probably within the next 12 to 24 months about this particular vaccine. So a lot of work has been done over 2 decades to try to get us there, and I really believe we're almost there.
Awesome. Thank you for that. Because I know we do talk a lot about that. And I'll tell you, as a pharmacist myself, I'm horrible at taking meds. So anything that when we talk about long acting injectables, and I know Keisha could definitely talk to this from even in the mental health space. And I think any chronic disease, if you think about somebody that has to take a medication every day, that does become difficult. And it's so important, we know in HIV AIDS to stay on a regimen, keep the medications in the system at a certain level. And so that's where I know is paramount for something like that. Let me ask another question before I go to the chat box, because I think we have some questions there. What exactly have we kind of pinpointed why we're seeing the difference in COVID-19, coming into the Black community? I know we talked about, close quarters, urban communities, not being able to do telework, but have we seen any differences in how they're being treated? And I want to say that because there was actually a gentleman from my company who's a physician, and he told us a story about his cousin in New York and how he had presented with symptoms to the hospital and they turned him away. And him not being as able to advocate for himself, actually went home. The whole family was sick. Was progressively like just worse. Like he was worse than everyone else in the home. And he got on the phone with his cousin and talked to him and kind of really encouraged him, like, no, go back to the hospital and kind of almost force your way to make them admit you. So I'm concerned about the difference in treatment for patients, especially them having possibly a comorbidity such as HIV AIDS. Like, are we seeing any trends? And I know, Kim, you've been working along, watching this coronavirus. Are there any thoughts around that? And Keisha, I know from a history standpoint, we could definitely talk about that difference in treatment and what that does to the psyche. So I'll start off with Kim, and then Keisha, you can come in, and definitely Kate.
Yeah, so I think what you've noted has been long experienced and also very well documented this year. I think the biggest thing is to try to be an advocate for yourself and make sure that you are asking the right questions. Make sure that if you feel as though you're not getting the adequate care that you should be getting, that you ask to speak to someone else. You continue to do that until people, I don't want to say take you seriously, but until people understand that you're not just going to sit back and take the type of care that they're actually offering to you. But I think the most important thing is, try to be somewhat informed. Google can be our friend, but Google can also be harmful. But just make sure that you're asking the right questions, whenever someone is coming in the room, whenever someone is administering a new med, ask them what it's for. How long is it going to be there? How did you determine the dose? So just making sure that you're asking questions to keep people on their P's and Q's, I have found often helps level the playing field, if you will.
Yeah, definitely.
Yeah, I have to add to that. I think you're absolutely right. And there's been historically, we've had difficulties getting the same level of care treatment-wise across the board, where we're talking about medical, physical health, or even mental health. And that is well documented as well, and is part of the legacy of racism that we've had to deal with for hundreds of years in this country, and it doesn't stop at the medical doors. So I do think that you have to advocate for yourself, which means getting good information from agencies that you trust, making sure that if we have family members who are coming to us with information and concerns, then we are encouraging them to advocate for themselves and go back in and get what they need. And no one is going to advocate more strongly than you can for yourself. You know how you feel. But I also think it's our responsibility as providers to fight for our patients, that when we see that there's inequity, that we do what we can to get the support for our patients. And then at the organizational level, we as organizations have to fight for whole communities who we know are marginalized, communities that we are forgetting, that we don't care for, and who we know historically do not get the level of care that they deserve and that they need. So I do think that we have to fight this because it's a systemic issue and we can expect it. On one level, if it's the worst diagnosis, likely we overdiagnose it in the Black community, and if it's care or treatment, we underprescribe it. And so that's just a general rule of thumb. And so we all have to sort of join hands in this fight to make sure people get what they need.
And just to that point, Kate, before I go over to the chat box, could you tell me, and you and Kim maybe can both answer this really quickly, have we seen a difference in patients who have HIV/AIDS and also them contracting COVID-19 like their morbidity or their mortality rates? Are we seeing any difference in that particular population?
So no. Oh, go ahead, Kate.
Oh, no, that's what I was going to say. At the beginning, there was a concern due to compromised immune systems, but as things progressed, I was told by providers that there's no difference with people living with HIV becoming infected with COVID-19 at a higher rate than any other population. Kim can probably talk to more about that, but I was just making sure that the clients were aware of the CDC regulations and all the updated information. There is so much misinformation out there that I was just trying to make sure to talk directly to the providers to make sure the clients have the most updated and informative information as possible.
Awesome.
Yeah, so overall, the answer is no right now with the data that we have currently. We can't say from a long-term perspective that that is the case. And it's also not to say that HIV patients can't contract COVID, because we definitely know that there are some that have. When you were speaking about morbidity and mortality for the audience, that basically just means that the symptoms that someone may have may be a lot worse, or they may end in death. So to date, we haven't seen that if you're HIV infected and you actually have COVID as well, that is the case. And there's also a small amount of data that has suggested that if patients are on HIV medications, they may be somewhat protected simply because the coronavirus as well as HIV are both RNA viruses. So from a mechanism of action standpoint, they have a very similar mechanism of action as to how they copy themselves. And so some of the HIV medications, it's been postulated, may actually prevent the production of new coronaviruses. But again, no solidified data to, put a stake in the ground to say that that's really the case or not. It's more of a theory at this point.
Wow, that's really interesting. And I can't wait to that data.
If I can just add from a mental health standpoint, the unfortunate side of that, because that is a bright spot right now, but the unfortunate side of that is that mortality and morbidity is high for African Americans in general. So even if a person who has HIV is not necessarily at increased risk, unfortunately, they may know someone who has been infected or who has died in their family. And that can add to grief, that, obviously will exacerbate any either existing depression or can cause depression in the future.
Yeah, and I think that's important to state too, from just being safe and contracting. So even if you think that you may be a little bit more protected for some reason, I don't think that that's a safe bet, right? And then also you could be affecting someone else. So if you contract COVID-19, you can pass that on to a family member that has other chronic diseases that we know increase that risk for death, right? So I think that's something to think about. I'm going to kick it over, and we are, moving along, but we're going to do like rapid fire responses in this next section so that we can answer these questions in the chat box, because I think it's starting to really get, full. So if I can just have you just answer really quickly so I can rat off as many as possible so we can get these questions answered. So I'm gonna go ahead and kick it to Kanessa. If you can go ahead with our first couple of questions.
Sure, good evening. We do have a few questions in the chat. The first one is the population of HIV positive persons dropping in Philadelphia?
No.
No. Unfortunately. Yeah, Kim, I don't, Kate, I know you guys are monitoring this really closely, but no.
Okay.
Right? Okay.
Opposite direction, actually.
Yeah, opposite. Next question.
Ready for the second question? Okay,
Yes.
Here we go. Why do you think that this current state of COVID isolation has encouraged men, African American men in particular, to relax their resistance to therapy?
Oh, Keisha, that's you.
Yeah, I honestly think that this is one of those kind of perfect storms where, with all of the protesting, the civil unrest, the murders of our citizens, unarmed citizens, it's putting things out there that otherwise we don't typically talk about. And one of the things that breaks down stigma is raising awareness and educating people. And the more you put that out there, and the more people are supporting it, so you have celebrities supporting it, you have people who you otherwise would have thought would stigmatize you or would ostracize you for talking about your grief or your depression or your anxiety. I think that the more people raise the awareness, the more comfortable people feel. And so we also have more people seeking out therapy. And when people do that and they don't keep it a secret and they reach out to others and they reach out to their friends, people are more likely to to follow through and actually try it themselves. So
Thank
I think in general, we have to raise awareness. We have to talk about this. And we all know this in the mental health field, that mental health has typically been a very private thing. It's been a really confidential thing. We generally don't talk about our personal secretive issues and concerns. And so it's like right to keep it under wraps and for people not to necessarily want to pursue it. But now we're raising the alarm. We're ringing the bells and raising the awareness.
Yeah. Anything from Kate or Kimberly from a medication standpoint and therapy from that standpoint?
No, to keep it
All
quick
right.
and moving.
Let's go to the next one. Martha, can you tell us if we have any more questions? I'm gonna keep going to you guys until we clear it out, and then I'll come back to me.
Yeah, there's a lot.
There are several questions. The next question is, how might a person get tested for HIV and other STDs without going to a doctor's office?
And so in that case, I would say it depends on the symptoms that you're having and the STD that you might have. So there are certain STDs that can be diagnosed via a blood test, and then there's others that need to have a physical exam and an actual swab, because there could be a lesion or an ulcer that may be there, and in 9 times out of 10 those cases, those need to be swabbed. But in a few cases, there are some STDs that would require a blood test.
Next question.
PEP is very difficult to obtain, especially for people unaware of the drug. Most people have to go to the ER immediately within 72 hours. How can we inform people of this and the resources surrounding it to make it more accessible to those who have been exposed?
So I will ask if Ahmad can come off mute, because PEP and PrEP are 2 different things, and I want to be sure that he actually means PEP and not PrEP.
I was thinking PrEP as well. I was thinking about that one. Okay. I know a little bit about
long explanation.
I know.
So PEP is if you know that you've been exposed to someone. So it's more or less a prophylaxis if you know you've been exposed. PrEP is more of a preventative if you are going to engage in risky behavior. So I'll assume he's talking about PrEP. From the standpoint of PrEP, you can go to any doctor's office, health department. There's also various mobile units and things of that nature that will actually write for it. So it is pretty accessible. It's just that people either are not aware of it, or, the same thought process as before of, I don't know if I want to take an HIV medication, because of the stigma around taking an HIV medication to prevent actually getting HIV.
Kate, anything that Action and Wellness is doing to help to advertise that more? I know I've seen commercials for PrEP, which I was really surprised by. I don't know if you guys have seen them on TV. And they always are like people, like not always, but I've seen them with people of color. So I know that they're targeting our community, but is Action Wellness doing anything around that area?
Yeah, so a lot of the times when we meet with clients or check in with clients, we ask them if they're sexually active, and we ask them if they're using protection. And then that's when we introduce the conversation around PrEP. And then we provide them with information and education around what it can do and how it can be a preventative measure. And then we're able to refer them to providers, or like Kim said, health centers that are able to assist in providing that information to them. And if they're interested, usually they take a bit of time to think about it and discuss it with their partner, but we always provide that open door for them to contact us if they want more information or a referral.
And
So it
just
really is about
people are-
talking, right? Yeah, go ahead.
Sorry,
Kim.
I was just going to say, just so people are aware, PEP is post-exposure prophylaxis, and PrEP is pre-exposure prophylaxis. So it's just a matter of the timing of when you think you might be exposed or have been exposed.
Okay. Thank you for
And there are
clarifying.
also several clinics that actually have PrEP clinics that are everywhere that are giving PrEP out, and because of some contractual things with pharmaceutical companies. So it's pretty easy to access if you actually want it.
Gotcha. So let me kick it back to Kanessa. Do we have any more questions? I'm probably gonna try to take 2 more.
Yes, here's a question. Does HIV/AIDS have a political platform for financial assistance for treatment and research?
So yes, on the global level, I think most of you have probably heard of PEPFAR, which the funding for PEPFAR has changed depending on who's in office, to be frank. But I will say over time, no matter who's been president, the amount of funding that's been available for HIV medications has gotten smaller and smaller and smaller, which is unfortunate. When we think about it from a state level, states also have directed funds to go towards people who may be underinsured or not insured at all. And so it's really, I guess not to be super complicated, it's based on the state as well as some other agencies that have input on how those funds are spent, whether they're spent directly on drug, whether they're spent on labs and other types of procedures and things of that nature, just to make it succinct.
And in terms of a social work perspective, we have Ryan White funding. So that's been stagnant for about 12 to 15 years, but provides support and funding towards programs within the communities. And so we do AIDS Watch, where we go each year and lobby and go to Washington, D.C. or contact with them this year virtually to explain our programs and basically say that we need more money.
Okay, got
But
it.
to her point, the number of cases has gone up,
Yeah,
but the funding hasn't.
Right.
yeah, that's the problem. Anyone, let's keep getting in the chat, and we're going to do fire rapid because we have a lot of questions and they're good questions. I want to get to them. So I think it's Martha next.
Hello, I am a BHC at an FQHC. Are there any mental health resources that you would suggest for survivors of COVID-19 who are experiencing PTSD-like symptoms after extensive hospitalization?
So we will be providing some information about organizations that help out, especially from a mental health standpoint. Keisha, I don't know if you have anything extra to add to that, but you'll actually see some resources at the end of this presentation. There are patient groups that we kind of lean towards from a mental health standpoint. So we'll kind of show that on the screen. But Keisha, do you have anything real quick that you want to add to that? Because I know you focus on PTSD.
Yeah, it depends on the resources that the person has available to them. I mean, more specifically, you know, depending on whether or not they have insurance or not. If they have open level resources, then a place like the Center for Study of Anxiety Treatment and Study of Anxiety would be perfect. It's at the University of Pennsylvania. I'm a strong supporter for empirically supported treatment protocols. And so they have a number of them that they use there. Some individuals need to contact community mental health organizations and agencies if they do not have insurance available to them. So it really does depend on just the resources that are available to them. But you want to look for someone who is competent at evaluating PTSD and also who also subscribes to the treatment protocols that are typically used to treat PTSD.
Thank you. And I just want to mention the National Alliance on Mental Illness. That is a patient advocacy group that's really known. So if you want to look them up, NAMI.org, NAMI.org. I know in my previous life, we talked a lot about them and what they're doing. They have a lot of information and definitely some resources in addition to what Keisha say. We'll take another question from the chat box.
Okay, can you discuss the recovery rate of COVID-19 for individuals infected with HIV?
So to my knowledge, there have not been any randomized controlled trials or I guess not case reports, but data that have a large amount of patients that have actually shown what their recovery rates are in HIV infected individuals. There have been case reports here and there, but nothing that have a large amount of patients to really directly answer that question. So I would say that there's not enough data available yet.
And I think we're going to start seeing things after. We're going to continue to learn, I think, over this time period. We'll take another question.
Since several pharmaceutical companies have received emergency approvals for COVID-19 as being 90% or above, nothing has been said how long will the vaccine be effective? 3 months, 6 months, 1 year, 5 years, or unknown? If unknown, what happens when it is no longer effective? Do we start infecting each other again?
I just want to, Kim, if I can jump in really quickly, if we can just remember the approval. So just so you know, and I know Kim was about to probably say this, no vaccine has not been approved to date as of December 1st. That may change in 2 weeks, but as of today, no approvals for the COVID-19 vaccine. Okay, Kim, go.
Yep, spot on. You might want to come to infectious diseases.
I know, right? No, I'm staying in mental health. It's okay.
So I think one of the important things to note about all the different vaccines is that many of them have different endpoints in their study. So we don't know as of yet, depending on the vaccine, because they all have different platforms, they have different dosages, they have different amounts of doses that are going to be given within, how long they're going to be effective right now. That's something that we need longer term data to really understand. And also it's going to be different because each particular person is different in how our immune responses work. That's the same not only for this vaccine, but also when we think about chickenpox vaccine or measles, mumps, and rubella. So all of the more common vaccines that we're used to hearing about. What happens when they're no longer effective, and do we start infecting each other again? I think what has become uncomfortable for a lot of people when talking about COVID-19 is that we will likely see more of a model of living with this very much in the same way that we have done with HIV. So many of the providers that are on the front lines have stated that, you know, what we're seeing now with COVID-19 infected individuals is very much like what we saw with HIV back in the early 80s. And then we've continued to learn to live with it. So I think the other point to make is that this will be probably one of the first pandemics of many that we will continue to see as well. So there could be, I guess, the answer to the question in multiple different ways. One, I think SARS-CoV-2 or COVID-19 is here to stay. I don't think that it's something that's going to completely go away unless we have like a global shutdown, which it appears as though that's not going to happen. Number two, when we think about some of our other vaccines where we have to get boosters, so like for a tetanus shot, for example, there could be a case where for certain vaccines that someone would have to go back and get a booster. They could do antibody tests to see if the person still has antibodies. And if they don't, they could be potentially fit to get a booster for that. But I don't think that SARS-CoV-2 is going away.
Yeah, unfortunately. And I see there's one more question in the chat box, and then we'll kick it back to us and close out. There was a question of where is free COVID testing for the uninsured? I'll start off by saying that just from experience, because I have a little OCD about COVID-19. So I've been like testing. I don't know why, just leave me alone. I start thinking I have symptoms, but anyway, for the uninsured, I know that CVS is allowing for you to do it. Also want to talk about the Black Doctors Consortium, right, Kim? And they're doing free testing as well. So CVS will ask you if you have insurance. If you do not have insurance, as long as you have symptoms, and I think that's the key is for some of these places, if you have symptoms, they are not charging. If you're just getting a COVID test because you just want to check, I think that's where you start seeing a charge. Kate, please let me know. Kate and Kim, please let me know if that is what you all are seeing as well. And I'm just speaking as a consumer.
Our agency has partnered with FPCN and once a month does free testing at our North office, which is at 6th and Lehigh. So if anybody's interested in that, we can provide resources. I believe the last one was about 3 weeks ago, and it's on, I believe, the third Thursday of each month. So I can, again, provide information on that when the next one is available, and you don't have to have insurance to complete that test.
Yep, so agree with the Black Doctors Consortium. She goes all over the city. She's actually on CNN tonight, so super proud of her for that. But the other place that you can look just for testing sites across the city is the city website. So there's a PA COVID19.gov website. I can put it in the chat in just a second after I look it up, but they offer where testing sites are in the city as well.
Awesome. So thank you everyone for questions from the chat. Just to wrap up with the last question, one of the things I would like to know from Keisha, how might members of the Black community in particular manage stress during this time? You're thinking about HIV/AIDS, you're thinking about social injustice, and you know that coming from those who are supposed to protect and serve, and then also thinking, you know, jobs lost, just everything happening. What are some ways that we can manage that stress in real quick?
Yeah. Yeah, I think it's important that one, we validate each other. We recognize that there are so many stressors right now, and all of us are feeling something. And even though we may not be in any kind of clinical ranges, and we may not be necessarily labeling it as anxiety and depression, the fact is the stress is there. And so if we acknowledge that, I think it helps people to feel more at ease. We need to educate people on some of the things that can be done in order to manage how they're feeling. You know, the reality is that stigma keeps us from learning more, stereotypes keeps us in that cycle of misinformation, and just taken together, we just lose out on opportunities to help people to identify when the changes they're experiencing with stress is going to lead to something more. So aside from that, I do think it's important for everybody to engage in wellness, you know, strategies and practices. You know, you have all these different areas of your life that are important to you and they uphold you. And just like anything else, when you knock one out from under you, you know, you want to have others that are supporting you, even when that one leg isn't strong, right? So, you know, make sure that if you're a spiritual person, that you're engaging spiritually, that you're reading your spiritual text, that you're praying, that you're engaging with people who you go to church with on a regular basis, even if it's by phone. You want to make sure that you're taking care of your health by eating well. Exercising may be limited right now, but what can you do in order to stay physically active? You know, you just want to exercise every area of wellness that you possibly can. And through those things, you can remain active, and that in and of itself will manage stress. I think the last thing, because we started off the whole conversation talking about isolation, is that it's really important to do your best to engage your community supports and engage your family and friend support the best way that you can. You know, you have to come up with creative ways to stay in contact, to keep that connection going. It could be something as simple as regular phone calls. It can be sending letters. You know, that's something that's been a lost art for the most part. It could be, you know, sharing a project, you know, finding a way to have a shared a shared project that in the end you all can account for. But you have to find creative ways to stay engaged and stay connected.
Thank you for that. And real quick for Kate and Kim.
And then more importantly, ask for help.
Exactly, it is. And just for Kate and Kim, just to wrap up, what's one thing that keeps you guys awake at night when thinking about treating this particular HIV/AIDS population? What's something that's still keeping you up?
There's a lot that keeps me.
That's what I'm reading all the time.
Something that I guess.
Well, I know something that keeps me up.
Tell us, Keisha.
I am really just thrilled at how we're highlighting so many areas of concern, and we're doing our best to try to figure out how to meet the needs of communities that we just don't pay attention to most often than not. And it's my fear that when this blows over, that we will forget those communities again. And I'm going to just encourage everyone, these inequities that exist in schooling, that exist for certain populations, like people living with HIV, that exist in the Black community, they don't go away just because COVID goes away. Exactly. And so, you know, I'm hoping that we can hang tight and have the fortitude to really stay connected to these communities and make sure they get what they need, and that we're fighting for them and advocating for them wherever we can.
Awesome, thank you.
I have an answer
thank
now.
You. Oh, Kim.
So I think that with respect to HIV, what's keeping me up at night is our Black men. You know, there have been studies that have shown in CDC statistics that show by in the next 10 to 15 years that 1 in 3 Black men will have HIV. So it's not just the impact of Black men, it's also that they're engaging with Black women as well. So that's for HIV. I can also talk about COVID, but.
Yeah, that's important.
So
and I wish we had, we know we have some men here tonight, but we need more. So next time, like, invite the men. They need to hear these conversations too. Kate, real quick, anything from you?
I had mentioned it briefly before, but I really think about the fact that people have lived through an epidemic and are now confronted with the pandemic. And I just feel like that's a unique experience. And I can't imagine what these people are dealing with on an everyday, daily basis when they've already lived through it and continue to be challenged by this.
Yeah, thank you. And I think that's a nice wrap up. So I thank you guys for helping me to bring fruition to this theme for this year for World AIDS Day, ending the HIV/AIDS epidemic, resilience and impact. Please, everyone, stay tuned because we have now prizes. So this is the fun part. But just before we do that, we're going to go back to our poll really, really quickly. And if you could put that on the screen, we'll see how much you guys have learned during this time period. So I know the scores are going to be even better. So we can do the poll really quickly. All right, it's up. Let's start getting some results in. All right, the results are starting to come in. Oh, this is going faster. Thanks, guys. And remember to stay tuned because now we have prizes to win. All right, we're at 24%. It's going. Oh, you guys are pros this time. I see that. You're shining. Okay, great. Thanks. That means that we did our jobs, ladies. Thank you. All right, and if you can share the results, I'm not sure if everybody, yep, if we can share the results, thank you so much. So there's an approved vaccine for HIV, true or false? Kim, what is the answer to that question?
It is false.
All right.
It's not an approved vaccine for HIV.
Thank you.
Or COVID.
People with HIV are more likely to contact SARS-CoV-2, true or false?
So that one is, that's kind of a trick question. Data thus far have not shown that people with HIV are more likely to contract COVID-19 or SARS-CoV-2.
Okay. The loss of community members compounded by the relative isolation based on stay-at-home orders and social distancing measures act as a stressor by limiting access to support system. Keisha, let's tell the people what the correct answer is.
It's true. I can't see the responses, but it should be.
Oh, it's all of the above. Sorry, you guys can't see it. So okay. 98% got all of the above, which is correct, right?
Yeah, I can't see the results. If you can scroll down.
Oh, okay, it's right here.
Oh no, it's me that I can scroll down too. Okay.
That's okay. The next question, people living with HIV are twice as likely to have depression compared to those who are not infected with HIV. Keisha?
Yes, true.
True. So not 89%, you guys did really well. And the last question, do you think that this is a beneficial to the community? 94% of you guys said yes. Thank you so much for your time. And at this time, I'll pass it along for announcements. Thank you, ladies.
Thank you.
Wow. I just wow. I know everyone who stayed with us and is watching, over 100 people, learned as much as I did, are as informed as I am, have been enlightened as I have been enlightened. And I just want to thank you all, Dr. Lynham, Dr. Clark, Dr. Brown. I did not even try to do that with the K's, and Ms. King, for spending your night with us and just sharing with us your expertise, your information, and giving everyone who tuned in all of this wonderful information. So we thank you all for your time and attention. From our chapter, from Philadelphia Alumni Chapter of Delta Sigma Theta Sorority Incorporated, you will each receive a gift from us. Next is, so everyone, our next issue is, where do we go from here? So on the screen, you'll see a list of all these resources: free HIV testing, HIV COVID-19 mental health resources, HIV transplant resources, and so on and so forth. You don't have to worry about taking a screenshot. Everyone who has registered and attended this evening, we will email these resources to you. If you have additional questions, you can email members of either the Physical and Mental Health Committee or the International Awareness and Involvement Committee, and those email addresses are listed at the bottom of this screen. However, again, you don't have to rush to take a screenshot, although I don't have the ability to tell you how to do that really quickly, but you will receive all of this information in an email from us, okay? Next up is our raffle, and I will turn it over to Sorors Vicky and Paula for that.
Good evening. What an exciting and informative evening. I had my speech all written. I think I was the one who suggested it, but for the essence of time, I just want to be very brief and let you know that this has been the 10th year of Philadelphia Alumni Chapter reaching out to the community. And we were really struggling with how we were going to be able to do it this year. So I think that we hit a home run this time because we have gotten a lot of information in a very different way. So thanks to all of you that joined us and those who continued to remain so that you can be one of the winners for the evening. We have been lucky to have a partnership with Brown's ShopRite under the CEO, President Jeffrey Brown. He has allowed us to each year for 10 years go to free markets and reach out to the community that we as Delta Sigma Theta serves. So we go there in particular because Brown's Supermarket is known to have people that live in the community work in their market. So he employs 2,300 members of the community at Brown's Supermarkets, and you'll have all that information as well if you happen to be one of the lucky winners. We are anxious to return to the Brown Supermarkets next year, ShopRite markets next year, so that we can have personal and up close contact with the members of the community. So again, thanks for joining us. I have Sorors Marita and Sorors Paula Lamb, who will, Marita will spin the wheel. Paula will make certain that those of you that are on, have remained on, are winners, and she will contact you and you will have an opportunity to personally go into a Brown's ShopRite and shop. And perhaps that might be a new location for you during this time, because you know, if we support the community, then the community supports us. So once again, remember to stay on, because December 1st, 2020 might be your lucky day. Marita and Paula.
Sir, Vicky, thank you so much. Let me actually, oh my goodness. All right, so let me just tell everybody, first of all, hello, thank you for Vicky, Victoria. I hope that everyone is ready for the raffle, and actually the raffle was ready before I was. But I just want to have a few ground rules for everybody to understand before we get into our next winners. First and foremost, everyone is a winner tonight because we received a great presentation with wonderful information. However, 9 folks, along with Ms. Florence Hubert, are also going to be able to win a ShopRite gift card, as was previously mentioned by Soror Victoria Rivers. Things to note for those of you who are winning, hopefully Florence is still a participant in this conversation. She is still active. We ask that she, along with the other 9 people who are selected, reach out to Paula Lamb via the Zoom private message apparatus. So basically in the chat box, send a private message to Paula Lamb, P-A-U-L-A, Lamb like the animal, same last name as mine. And just confirm your contact information so that we can make sure that we get you the gift card as soon as possible. So because my mouse was very sensitive, we see that our very first winner is Florence Hubert. So please, Florence, reach out to Paula Lamb via our direct chat and confirm your contact information. And so now we're just gonna get to our next 9 winners. Okay. Congratulations, Dr. Paula. It's your lucky day. All right. Vita Williams, congratulations. Vita, can you talk to Paula? All right, got a few more. Congratulations. Marcella, please reach out to Paula as soon as possible. All right, let's see who our number 5 winner is. Precious Minds, congratulations. Let's give you another day. Precious, congratulations. All right, let's see who our number 6 winner is. All right, Geraldine Miles, my principal. Congratulations. Got a gift card. All right. All right, Jennifer Banks. My fellow schoolmates, congratulations. All right, number 8. Congratulations. Congratulations, Andrea. All right, let's see, we got 2 more to go. All right, so Marvetta Coleman, congratulations. Marvetta, can I please reach out to Paula Lamb, all of our past winners, please reach out to Paula Lamb. We have one more opportunity. Again, we're all winners, but 10 of you will have an opportunity for a gift card. Let's see our last person. Cynthia Hopkins, congratulations. Cynthia Hopkins, wonderful. Okay, so thank you so much to all who have won. And again, we all are winners because we have received wonderful information from our panelists this evening. So thank you so much again. And I will turn it back over to Sora Victoria to close us out for the raffle.
Thank you again, everyone who joined us this evening. We are more than thrilled that COVID-19 and any of the other things that have happened has stopped us from doing the service that we insist upon having in the community in and around Philadelphia. There are, as I mentioned, there are 10 Brown Super ShopRite markets. When you receive your information, those of you that are winners, you will receive the names of the other 10 in and around the Philadelphia area, as well as those of you who were not winners tonight. Although my philosophy is everyone is a winner, just as Marita mentioned. Please make certain that you patronize those markets that make certain that we are able to work and serve. So once again, thank you so much. Please know that we are here and that our information is available just by going to our website and picking up additional information on this event and many of the others that we have at this time. So again, thank you, thank you, thank you.
All right. I like that. How many people were clapping during the little Wheel of Fortune thing? Dun, 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 dun. I was, but my name didn't come up. We are now going to thank you all for hanging in there with us through the raffle. Congratulations to all of this evening's winners. And we will now have our closing remarks from Physical and Mental Health Committee Co-Chair Robin Wheeler and International Awareness and Involvement Committee Co-Chair Trina McLean.
Hi, good evening, everyone. Thank you, everyone who have participated. We have learned so much today, and as Sora Vicky said, we are all winners this evening. I just wanted to highlight a few things, takeaway things that our panelists have shared. On this day, African Americans are still disproportionately impacted by HIV and AIDS. We still have to make sure that we share the resources for access to care, whether in person or virtually, because we still need to do testing services when necessary. We have to be social isolation to prevent the continued spread of this disease and COVID-19, but we can find creative ways to still be supportive and share socially with one another, even though not in person. And there are lots of advances that are happening going forward. There's progress towards a vaccine for both SARS-CoV-2 and for HIV, and there's progress in drug delivery systems that it can improve adherence and outcome for patients living with HIV and AIDS. So thank you very much to all of our participants and all the lessons that we learned on today.
Hello, my name is Trina McLean, and I'm the other co-chair of the International Awareness and Involvement Committee. I would like to take this time to thank the panelists for such an informative and enlightening presentation. I would also like to thank our moderators, Sora Leslie and Sora Karima, for keeping us on track and keeping everything running smoothly. And I would like to thank you for taking time out of your busy schedule to support us on World AIDS Day. I hope you enjoyed it, and I hope you learned something new. And if you did, please share it with a friend, family member, or coworker. We all need to stay informed, especially during times like this. So enjoy the rest of your evening. Happy holidays and stay safe. I have one quick announcement though. Will all members of the International Awareness and Involvement Committee, Physical and Mental Health, the executive officers, and the panelists, please stay on after this. To everyone else, thanks again for joining us and good night.